Hey guys, so in this lecture we're going to be talking about systemic infections. So we're going to be talking about infections of like the lymphatic system and a little bit of the cardiovascular system as well. So let's go ahead and get started. It's a relatively short lecture, and also hopefully y'all get a giggle as to whenever I butcher some of these names. Okay, so a systemic infection, this is where it starts in one part of the body, but then it spreads to another site. And generally that travels through the lymphatic system or through the cardiovascular system. So the lymphatic system, this is where fluids and our white blood cells are involved in fighting off infections and then also providing nutrients throughout our body. And then the pulmonary system, this is the circulation of blood that will actually go through our heart and lungs, whereas the systemic, this is the cardiovascular circulation that will travel between the heart and the rest of the body. So it's a little bit different, but let's look at a pretty picture. So our lymphatic system and our blood system goes throughout our entire body. So it's all the way from our toes, all the way to the top of our head. It's very, very important. And then if you do have an infection that does involve our circulation or lymphatic system, you can imagine it's very, very difficult to treat. Sometimes it's not even curable, but depending on what it is, it can definitely be treatable. But sometimes it can be very, very difficult because of the fact it goes everywhere in the body, and also the fact that it has a perfect highway for it to spread. So it's very, very difficult. And we're going to look at some of these infections that are listed here. So with that, let's go ahead and talk about some inflammation that comes with some of these infections. So the first bullet is inflammation of the heart. So depending on what part of the heart is inflamed is how you will categorize it. So if you have inflammation of your endocardium, then it's endocarditis. Of your pericardium, it's pericarditis, and then myocardia is of your myocardia. So that is different regions of your heart, different layers of like muscle. So it's not your heart as a whole. It's only a part of your heart. Now with your lymphatic system, depending on what is actually swollen or inflamed will also determine how do you categorize it. So, sorry guys. So if you have swelling of your lymph nodes, such as like the ones like by your ear, jawline, or your armpits, that is called lymphoendopathy. Now, if you have actual inflammation, not just swelling, so if you have like redness to it, a lot of times that will be lymphadenitis. I believe that's how you say it. And then if you have inflammation of the lymph node vessel, which is actually this picture down below, so you can see that it's a vessel, so meaning that it travels. So it's like the highway, whereas like this is just a lymph node. So this will be the third bullet point for y'all. And then this is the last one where it's inflammation on the lymphatic vessel. So this is lymphangitis, something like that. Okay, so definitely be able to differentiate those, most likely from like a picture or something of that nature. Okay, so let's talk about systemic viral infections. So systemic viral infections, they're relatively rare in healthy people, but the more common one that you could that we're going to discuss is reactivated latent herpes. So that's probably the most common cause of a systemic viral infection, but that primarily happens in immunocompromised patients. And then there is something called the EBV. So this is infectious mononucleosis. So this primarily occurs in patients that are severely immunocompromised, such as people that has Hodgkin's disease, or they have nasopharyngeal carcinoma, or they also have tunnel carcinoma as well. Sorry guys, I'm going to be butchering all these. And then there's also CMV. So this is very, very similar to the previous infection, where it will present a lot of times in immunocompromised patients. And then also the herpes simplex virus. So this is associated with the genital and cold sores. So normally you don't see viral systemic infections in healthy patients. So let's say, for example, you have a patient, they have the herpes simplex virus, but other than that, they don't have like cancer or any other disease that can weaken their immune system. Then the likelihood of them getting a systemic infection because of the fact that they have herpes simplex is very unlikely. So let's talk about the previous infection that I mentioned, the infectious mononuclease. So specifically the Epstein-Barr disease. So this is also known as the kissing disease. So the primary symptoms is a high fever, the swollen neck, and also enlarged lymph nodes, primarily the ones in the neck region, as well um, in the armpit area or the groin area, and then severe fatigue. So as you can see, and actually in the picture below, this is the lymph nodes that is severely enlarged in the neck region. So what happens with this virus is that the B cells there are infected, and then they are they're induced, and they become plasma cells. And then those plasma cells will start secreting antibodies that will result in non-specific antibodies that will react against pretty much anything. So that's not good. You don't want your antibodies to be reactive to everything. So that's the general pathogenesis of this virus. So in order to test for this, you can do a monospot screen test for these antibodies to see if these antibodies are specific or non-specific. And then what will happen is that if the virus does disseminate, it can actually cause liver enlargement as well as spleen enlargement. It can even result in meningitis or encephalitis. So meningitis is inflammation of your meninges, and then encephalitis is enlarging of your brain. So none of those are good. If it does continue, then sometimes cancer, lymphoma can develop primarily around the lower jaw and eye region. But this is generally associated with people who are HIV positive and have had malaria. So if you have a patient that has this, but then they're also HIV positive, you definitely want to look out for the Burkitt lymphoma. But just because they do doesn't mean it will manifest. But just keep an eye out. Okay. So let's talk about dengue fever very, very briefly, and then also Ebola. So dengue, it is an epidemic in tropical regions. We don't get dengue here stateside, but what it does is that it will cause extreme pain in the joints and muscles, and it's primarily transmitted through mosquitoes. And then also there is a variant of it, so meaning that there's a kind of like a little subsection presentation of it that can actually cause hemorrhagic fever. That's pretty much all I'm going to say about dengue fever. I don't really know too much about it. So I just want you to know what is dengue fever and how does it present. And then same thing with Ebola. So Ebola, we had a scare of almost having a pandemic a little while ago, back in, I believe it was Dallas. But I'm going to be honest, that nurse was stupid. She didn't take the necessary precautions. But she's alive, so it's okay. So Ebola, we don't normally have it here, but it is very, very prevalent in African regions, and it's a very quick virus. So you'll get a fever, muscle pains, and a lot of times you'll get bleeding from multiple different openings. So your nose, your mouth, vagina, and anal region. So that's the big hallmark of Ebola, where you'll get the bleeding, and then it is transmitted through specific bodily contact, and a lot of times it does take the life of the patient. So if you whenever you have a patient that's coming in and they're bleeding from different orifices, you need to make sure that you put on contact precaution, and you need to make sure that you ask them, like, hey, have you traveled outside of the country? So, with Ebola, the hallmark is the bleeding from bodily openings. Okay, now let's talk about systemic bacterial infections. So these are probably the ones that you care more about, and they're a little bit more gross and fun. So we have septemia. So septemia is whenever a pathogen enters a bloodstream. So it can be any pathogen, but what it does is that it will overcome the initial innate immune responses, and then it continues to replicate. So if you have a infection or a pathogen that was bacteria and it enters your blood system, then it's bacteremia. Now, sepsis, this is whenever a chemical is released into the bloodstream in order to fight the infection, but then as a result, it triggers inflammatory responses throughout the entire body. So, like, you'll get fever, you'll get the chills and shakes, and you'll have a very, very low body temperature compared to normal. You won't want to urinate. You'll have rapid pulse and severe diarrhea. And then a lot of times, if sepsis progresses, your kidneys will start failing and your heart will start failing, and that's severe sepsis, and that can very easily result in death. And then septic shock. So septic shock is whenever you have sepsis and your blood pressure just plummets, and that is because of the fact that you have severe sepsis. So you're unfortunately on the verge of death. And then what happens is that excessive coagulation causes small clots within the blood vessels. So that is what makes that's what makes your blood pressure drop. And then if you have a fear that your patient is going through this, then you to confirm it, you can look at their platelet counts. If their platelet counts are low, then that means that blood is leaking, and sometimes even a rash is present. So this is sepsis right here. Unfortunately, this baby has sepsis. So that's the presentation of it. Okay, so let's talk about the plague. So here's our plague doctor. He's a beautiful doctor, a fabulous doctor. So the plague is actually bacterial based. So it is caused by BIOL pestis. So it's a gram-negative rod. Generally, the reservoir for it is rats, prairie dogs. We do actually still have plague stateside. It doesn't, for the most part, there's maybe max of 5 cases a year of the plague. But normally what happens is that fleas live on rats and they live on prairie dogs. And then the fleas is actually like the vector for it. So this is where the virus will like replicate and everything and reproduce. And then what will happen is that you'll be like hiking or something, and you'll be around squirrels, you'll be around prairie dogs, and those prairie dogs or squirrels, they have fleas, and those fleas will bite you, and then you'll get the plague, essentially. And that's why they always tell you whenever you go camping to always check yourself for bites, because you can get the plague. And then we'll actually talk a little bit later about Rocky Mountain fever, and that's how you get and also Lyme disease, you get that from tick bites. So, but anyway, there's 2 different types of plagues. There's the bubonic and the pneumonic. So the bubonic, this is where you get the black lesions on your body, and this is where the bacteria will grow within your blood and lymphatic system, and that's why you'll get those black spots. But whereas the pneumonic, this is where it grows inside the lungs. So they have different presentations, but caused by the same pathogen. So during the Middle Ages, the Black Death was very, very responsible for a good population control of about 1/3 of it. So if you ever hear something referred to as a Black Death, they're talking about the bubonic plague and not the pneumonic plague. And really the only reason why, as to why the plague spread so easily, was actually because they didn't know about fleas. They may have known about fleas, but they didn't know that a flea was actually causing the issue. So whenever they were getting rid of their dead, they weren't actually actively getting rid of the issue, because once the person's dead, it's not really going to cause too much um, too much spread, whereas it really was actually the rats and the fleas. So it was actually because of their sanitation issues why it spread so easily and so quickly, because they were at the time very, very dirty, because they did not know about cleansing, like being clean. So that's actually why it spread more. So it wasn't actually because of the pathogen, it was just because of sanitation issues. Okie dokie. So here is a kind of like a pathway of how does the plague spread. So like I said, like if you were to go in a like wildlife and everything, the likelihood is that you're going to come encounter with prairie dogs and squirrels. So you ever think like feeding a squirrel is really cute? Like if you're ever at UTSA, those squirrels are brave. Um, don't feed them. That sounds really bad, because they could have fleas on them, and that flea can jump on you, and then you can get infected. But I'm gonna be honest, the likelihood not very common. But this is kind of just like a little pathway of how does it actually spread. Okay, so with that, let's go ahead and talk about Lyme disease. So Lyme disease is also caused by a bacteria. So it's caused by a gram-negative, and the reservoir is like mice, squirrel, deer, but the actual vector are ticks. And there's 3 stages to Lyme disease. So what will happen is that you'll be exposed to it, you'll get a tick bite, and then what will happen is that the bacteria will disseminate throughout the body, normally causing a rash. And it has a hallmark rash. It's called a bullseye rash, where like you'll have literally a red spot in the center, and then you'll have normal skin color, and then you'll have another red circle around that original red dot. So that is pretty much, if you see that on your body, and after like you went camping or something, or if your dog had a tick on it, anything of that nature, and you see this rash on you, definitely seek medical attention so Lyme disease doesn't progress. So you'll have that rash, you can get fever, you can get muscle pain, joint pain, and then sometimes even a headache, depending on the person. And then after it has spread from the blood, it'll go to the other organs. And that normally takes about weeks to even months, depending on how strong your immune system is responding. And then in this time frame of after maybe like 3-ish, 4 months after being infected, you'll have excessive weakness, muscle pain, joint inflammation, and you may even have some neurological and cardiovascular involvement. But that is also, the severity of it will also be dependent upon the person. And then after months and years, what will happen is that the joint will it'll be borderline like arthritic. You'll feel like you have arthritis. And then your nervous system is also affected, as well as skin. So with your nervous system, you can have some cognitive decline, or like the excessive headaches and migraines. And then with the skin, depending on the person, but a good presentation is generally the skin becomes very, I don't want to say scaly, but it becomes very dry, very hard to maintain moisture, and very sensitive. So that's Lyme disease. So typhoid fever. So typhoid fever, what it does is that it will cause fever. It can also cause confusion. So some neurological aspect is involved in typhoid fever. You'll have abdominal distension, meaning the belly will look bloated, excessively bloated. And then also you'll have short-lived rashes on your skin. So you'll get like these little dots. So that's the rashes. The causative agent is salmonella, and um, I believe you pronounce it enter enterica. I believe that's how you say it. Um, Cereve typhi or Salmonella typhi. I'm super lazy. So it is a gram negative. It's a rod. It does avoid our immune system because it can actually actively live inside macrophages within your gastrointestinal region. And that is actually how it gets transported into your circulation system, because in our stomach we do a lot of absorption, so that is what will happen. So if it continues to disseminate, it will infect various organ systems, so like your lymph nodes, your kidney, your liver, your spleen, bone marrow. A lot of times gallbladder infections can convert somebody into a chronic carrier, which is called typhoid Mary. So if they have a bladder infection, then uh, it can be more severe, essentially. So it'll have a more presentation. So the bacteria, it will continue to disseminate and spread. And what will happen is that if somebody doesn't know that they have typhoid fever, it can be transmitted through the fecal oral route. So you can also get it. So like if somebody were to, let's say somebody goes to the bathroom, they go number two, they don't wipe their hands properly, and they can also uh, transmit to somebody else, like in the household or something, or they shake hands at a business meeting, who knows. So it can definitely be transmitted person to person. And if a typhoid fever is present, antibiotic therapy is required in order to clear the infection. So that's typhoid fever. Let's talk about Rocky Mountain spotted fever. So this is caused by R. rickettsii, I believe that's how you say it. This is also transmitted through ticks, but it can also be transmitted through lice. So the hallmark of Rocky Mountain spotted fever is actually spot rashes, and generally it will begin on the wrist and ankle regions. So as you see, like it's literally like little red dots on you. So with that, um, it will eventually spread to the rest of the body. So that's all we're going to talk about spotted fever. Just know what it's caused by, how it's transmitted, and what's the clinical presentation. So that's actually pretty much what I want you to know for all of these diseases. Okay. So now let's talk about bacterial infections of the heart. So bacterial infections of the heart can include either the pericardium, the myocardium, or endocardium. So the pericardium and myocardia, whenever they're infected, they're more rare compared to endocardia. So most likely, statistically wise, if you do fear that a patient has a infection of the heart, it's probably infection of the endocardium. So depending on the infection type of the endocardium, it can be classified either as acute or subacute. So subacute is whenever it's like slow progressing, and it's usually caused by strep species from the oral cavity. So this normally will happen during like dental procedures. So that's why they always tell you like brush twice a day and do mouthwash and everything. Make sure you're flossing. So whenever you do go there and you get your teeth cleaned and they're creating little abrasions like on your gum, because there is some strep species inside our mouths. So whenever they're scraping, they don't want to introduce strep into your bloodstream. And a lot of times, if strep does get into your bloodstream and your body doesn't catch it, it will go to your heart and attach to your endocardium. So that's generally what will happen if you have a subacute. Now, acute endocarditis, this is where it's like rapid onset. So this is very, very quick. It's very, very destructive to the heart, and that is normally associated with Staph aureus infections. So what will happen is that, so this is actual, like after like an autopsy was done. So this is vegetation within your heart. You do not want that. And then as well as this. So this is inside your heart. I believe it's on the valve, if I remember correctly. So it this is where the bacteria started growing inside your heart. And you don't want anything inside your heart except for blood. So definitely it's very, very life threatening. And then also it's very, very hard to treat, especially if it's an acute bacterial infection. It's very difficult to get medications there, and then also at that point a lot of times the bacteria, it may even be resistant. So sometimes life expectancy is not too high. Okay, so that's all we're going to say about heart infections. So let's talk about some systemic parasitic infections. So these are some of the parasites that we're going to talk about. We're going to talk about malaria, and I believe we're going to talk about some, I believe it's pronounced Chaga disease. These are caused by protozoas. And then we are going to talk about some nematode infections, so worms. So let's go and get started. So we have malaria. So this is a compilation of a brain inflammation and then difficulty breathing, low blood sugar, anemia, so low iron, and then it can result in death. So malaria is not very common in the U.S., but it is very common in South America, Mexico, Africa, and then some of the Southern Asian region and then Middle East. So it's generally characterized by fever, chills, vomiting, and excessive headache. Oh, excuse me. So there are 4 major forms. So it can be either Plasmodia, I believe it's called Vivax, and then there's P. ovale, and then P. malariae, and then P. flaccipart. I believe that's how you say it. It is transmitted through mosquito bites, and then what will happen is that a mosquito will get infected, malaria will reproduce in there to a certain extent, and then what will happen is that the mosquito will go bite somebody and then inject the malaria. So it's definitely a vector as well as a host, because it's also a host because the malaria parasite can reproduce inside the mosquito. So let's look at that. So this is the general life cycle of malaria. I do have a video linked to this photo, and then it's also on the next slide. So you can definitely watch it at your leisure. But generally what will happen is that an infected mosquito will bite a human, and then at that point it will enter the bloodstream. The malaria point at this point is called, I believe it's sporadizoites, I believe that's how you say it. They will travel to the liver, and then the malaria will reproduce inside the liver, and then once it gets to a certain maturity, then it will be released back into the bloodstream, and then it will continue to replicate as well as in the bloodstream. And then what will happen is that at that point a mosquito will come again and bite, and then that mosquito now is infected, assuming the mosquito wasn't already infected, and then it can go and bite somebody else. That's the very general life cycle of malaria. Like I said, I do have a video embedded in. I'm not going to show it, but definitely watch it. It's a very, I believe it's only like 4 minutes. It's very quick and easy video. Okay. So with that, let's talk about another parasite disease. So we have Chaga disease. So this is caused by T. cruzi. The reservoir is rodents, opossums, and armadillos. So it is here, like we do see it somewhat stateside, but not very often. The vector is known as the kissing bug, which is this lovely guy right here. And then what happens is that you'll get bit, and then it will defecate inside wounds. So the bug will poop on you. And then if you do become infected, you'll have fever, swollen glands for the first few weeks. And then depending on the person, sometimes it can even develop into chronic system. meaning that it'll cause damage to the nerves. And then a lot of times, if death happens, it's because there is also damage done to the heart. So that's the Chaga disease. And then we have toxoplasmodia. So toxoplasmodia, we do see this in the US, because it is actually transmitted through uncooked meat and then also through cat feces. So it's caused by T. gaudii. So it's a cyst-forming protozoa. So it forms like little, they're not tumors, but they're kind of like tumors where they're like bubbles on you essentially. So you'll get it through ingesting undercooked meat and then also coming in contact with cat feces. So that's why whenever a pregnant woman has a cat, they always tell her, don't do the litter box. Like when you're pregnant and if you have a cat, don't touch the litter box. Don't do it, because if a pregnant woman contracts toxoplasmodia, it can result in stillbirth and then neurological damage to the fetus. So this baby actually was born, but neurological damage was done, so it has a lot of encephalitis. So it's better just to get the husband to do it or pay somebody to do your cat feces so you can avoid this and then also even potential death of the child. So here is the general life cycle and pathogenesis of toxoplasmodia. Like I said, I do also have a video linked to this, so definitely take a look at it. So you don't, like I said, if you're pregnant, you can be around cats, but you can't do the litters. Like, you don't do litter. Okay, so like I said, here's a video that goes over this figure. And then we only have this last slide. So now we're going to talk about lymphatic filariase. So this is caused by a nematode, and y'all probably know it as like causing elephantitis. So this is primarily found in Africa, Asia, Pacific Islands, so like Indonesia, Philippines, that area. It is transmitted through mosquito or fly bites. So what will happen is that if this nematode is introduced into the bloodstream, it will cause blockage inside your lymphatic system. So wherever it may be, normally it's inside the groin and leg region. So depending on where the blockage will occur, will result in swelling. So elephantitis is associated with limb swelling. So as you see right here, so for this, For this patient, the blockage occurred in the leg, so then they had elephantitis. Whereas this patient, they had blockage in their groin region, which is known as hydrocele. So this is where the scrotum will swell. And I do also have a video linked to this one, which is this video. So it does go over that disease caused by a nematode. Definitely take a look at these videos, guys. I'm not showing it on here because I don't want to get dinged for copyright. And then also, y'all may not like videos, and then you can just look at the figures if necessary. Definitely take a look at those supplementals, those supplemental questions and everything that I posted. Definitely get used to case studies, since now we're in the portion of term where we're talking about a lot of infections. So what I'm most likely going to do on the last few exams is stating that you have a patient that has XYZ, and you need to be able to tell me a potential causative agent, as well as maybe just the name of the disease, depending on what disease it is. But we talked about basic anatomy of the cardiovascular and lymphatic system. We talked about the different inflammation types, so definitely know those, guys. And then various infections. So like I said, be able to tell me what the symptoms are, be able to differentiate between infection types based on clinical presentation, as well as know causative agents. And then we did talk about some life cycles today. I do want you to know those, but nothing beyond what the figures and the videos say. So anything outside of that, don't worry about it, but just focus on what was covered on that the figures cover as well as the videos. So definitely take a look at those. If you have any questions, definitely don't hesitate to contact. If not, I will see y'all in class.